Josie Reeser, and today I'm going to be doing a quick little overview of conception and pregnancy. So we can start off with the female reproductive anatomy, which is composed of the vagina, the cervix, then the uterus, which leads to the fallopian tubes, and then the ovaries. So once every month during the menstrual cycle, a female will go through ovulation, which is when the ovaries release an ovum or an egg through the fallopian tubes, which goes down into the uterus. Um, if the ovum isn't fertilized by the time that ovulation period is over, that is when the uterine lining will shed, um, which is more so known as like having your period. Um, yeah, so that's pretty much the female reproductive anatomy. Yeah. So, in regards to the male reproductive anatomy, um, so the sperm is produced in the testicles, which then travels through the vas deferens to the prostate, where seminal fluid is combined with the sperm to create semen. And then from the prostate, it leads through the urethra during ejaculation. And that's usually how intercourse leads to fertilization. So, when fertilization occurs, it is when semen, which is a combination of sperm and seminal fluid from the male reproductive system, enters the female reproductive system through the vagina, then through the cervix, then to the uterus. And if this happens to occur during a female's ovulation period, when the eggs are traveling from the ovary through the fallopian tubes down to the uterus, you can see that happens here. So when fertilization occurs, it is when only a single sperm cell travels through the vagina, past the cervix, into the uterus, and then usually fertilization will happen about here in the fallopian tubes. It can happen down here as well. It's less likely to happen like here, just because the sperm would have to live for a very long period of time in order to reach the egg at this point here. I actually have it shown right here. But so during fertilization is when the sperm meets with the egg or the ovum that comes from the ovary down to the fallopian tube, and that is considered fertilization. So then if we look at implantation, that is after fertilization has occurred. So when the uterine lining is nice and built like this one is here, it's suitable for pregnancy. So when fertilization occurs, the egg will continue to travel down the fallopian tubes to the uterus, and implantation is when that cell will attach to the uterine wall, and that is when pregnancy can be confirmed. That's when the body starts secreting hormones in order to start the process of developing a zygote or a fetus. So that's implantation. So when fertilization occurs, implantation doesn't always occur. So fertilization is not when pregnancy really starts, it's more so when implantation starts. So fertilization does occur, but it doesn't implant here on the uterine wall. It will usually just be expelled with the uterine wall during the period. So then if we look at fetal growth, I'll just go through kind of the main stages of fetal growth. So during the first week 1 to week 8, that is called the embryonic period. And this is when all body systems are present in a basic form. So just throughout this first 8 weeks here is when all body systems of the fetus um, will be present, and as well as ossification, which is bone formation, that will begin as well. Limbs will be present, and heart tissue is usually fully functional at 4 weeks. So just when the fetus is that small, is when the cardiovascular system will be fully functional. And there will also be spontaneous muscle contractions during this time. So about weeks 9 through 12, so kind of in this period here, the gender or sex of the baby can be determined through blood tests, and facial features will also begin to form. So how gender is tested is that the fetal and the mom's blood don't mix except in the placenta in early pregnancy, as um, the mom's blood is circulating and the fetal's blood is circulating. Um, Sometimes they can both be in the placenta in early pregnancy before the placenta really starts circulating fetal blood. As the blood is transitioning, the fetal blood can be in the mom's blood, and then you can test for the gender using the DNA that's found in the blood. So that's really cool. And then weeks 13 through 16, so just in this basic period here, the fetus will begin blinking eyes and sucking its lips. Weeks 17 through 20, so in this period here, quickening begins to happen, which is when the mother feels movement of the fetus. So it's really cool to look at this picture here and see how small the fetus is and be able to feel the fetus at such a small size. I think that's really cool. And this is when usually the fetal position will start to really occur. So the fetus will have to kind of curve in regards to the space of the uterus is getting smaller because the baby's growing in such a small space. So then weeks 21 through 30, so kind of in this general area here, is a lot of growth. So you can see that the baby grows like at an exponential rate right here. Yeah, so that's really awesome how just in a few weeks the baby can grow like twice its size. And then weeks 30 through 40, so from the last trimester pretty much, there's a subcutaneous fat accumulation in the baby. Yeah, so then we will go through kind of the stages of labor and delivery. So the stages of labor first start with dilation of the cervix. So this is when the cervix starts to kind of get bigger, and what hormone will produce this is oxytocin will cause the cervix to dilate, and full active labor will start during this period, and then the baby usually won't be ready to be delivered or expelled until the cervix reaches 10 centimeters. So the female's body will produce oxytocin, which causes the cervix to soften and dilate. Usually, if a woman is having complications and the cervix isn't dilated enough when labor needs to happen, anesthesiologists can induce Pitocin, which is a synthetic form of oxytocin, which will kind of force the cervix to dilate a little bit quicker, so that way active labor can start. Another cool thing about early stages of labor is the hormone relaxin will be produced. This kind of happens all throughout pregnancy, but kind of leading up to this moment. So relaxin is a hormone that the female's body produces to kind of relax the muscles and the ligaments in the pelvic area to prepare the body for labor. Um, so then, when the baby is actually being pushed out during labor, this is called the expulsion period. Um, and that is just like active labor. That's when the actual labor is occurring. And then after the baby is delivered, you of course have to deliver the placenta. So the placenta will detach from the uterine wall, and that will have to be delivered as well. So yeah, I think it's really cool how from the steps of fertilization to like actual labor and then delivery, um, how much happens. And yeah, I hope you enjoyed this little presentation. There's obviously so much more to learn about this subject, but this was kind of just a small little overview of the basic things that happens during conception and pregnancy. Yeah, thank you.